You've probably seen this video. According to the World Health Organization World Malaria Report 2025, there were about 282 million cases and 600,000 deaths globally due to malaria in 2024. Now, Africa accounts for 95% of these cases and deaths, mostly affecting children under the age of 5. Today is World Malaria Day, and here are 4 things worth knowing when it comes to treating and preventing malaria. For some people, it can show up in the classic way, with high fever, chills, a pounding headache, and the kind of body pain that makes it so difficult to get out of bed. But for some others, it can be a little less obvious, with dizziness, loss of appetite, nausea, or fever. In children, it can look a lot different, with irritability, vomiting, and unusual levels of sleepiness. The challenge is that these symptoms are prevalent in a lot of other illnesses, and that is why we advocate for testing first so that you can get the correct illness from the start. Recently, there's been concerns around certain anti-malarial formulations, specifically the artemether-lumefantrine multi-dose oral suspension. Now, why is that? This is because once they are mixed, they can actually lose stability over time, and that puts into question their efficacy. Now, this is why brands like Enzor are making the shift to a more reliable option, such as dispersible tablets formulation. Now, dispersible tablets are a more reliable option because they dissolve easily in water, they are pleasantly flavored, and you are sure of giving your child the complete dose that they need every single time. Most importantly, they make it easier to complete the full dose of treatment, which is key to clearing out the malaria parasites completely. We've seen patients try to manage their symptoms with folic acid, agbo, painkillers, or a random mix of antibiotics. Now, the truth is, the fever may reduce, your body may feel a little better, but that relief can be misleading because the malaria parasite might still be in the bloodstream. And during that delay, malaria can persist, return, or worsen. Relief is not cure. Only the right treatment can treat malaria completely. Malaria control isn't just about treating symptoms. Prevention matters also, especially for those most at risk. Simple measures like sleeping under an insecticide-treated mosquito net, the use of mosquito repellent, as well as keeping your surroundings and environment clean go a long way in preventing malaria. For children, seasonal malaria chemoprevention (SMC) and perennial malaria chemoprevention (PMC) involves giving children sulfadoxime pyrimethamine to reduce the risk of severe malaria. For pregnant women, intermittent preventive treatment in pregnancy (IPTP) is given during antenatal visits to prevent complications such as anemia and low birth weight. These are simple planned steps to stop malaria before it starts. So when next you visit your clinician for your child or during pregnancy, ensure you ask them about SMC, PMC, or IPTP. You're welcome.